Hello, Professor Well. Do you know anything about the founder of American Red Cross?
I know Clara Barton was the founder of American Red Cross. She started the Red Cross, I think, somewhere around 1881 at about age 60. I know she was a teacher and she really wanted to help people. And that's what was her life work. She was, I believe she was the president of the American Red Cross until she died. You know, actually I started out as a receptionist in a pediatrician's office. I worked in pediatrics for about 6 or 7 years. And one day there was a medical assistant that left, so they needed to hire someone else. So they literally, the doctors and the nurses, took me from the front office and trained me in the back office. I learned how to do injections and take patients back, and I learned a lot of different, and billing a lot of different things. And then actually what I was going to do, I was going to challenge the medical assistant board to become a certified medical assistant. And the doctor that I worked for, Dr. Joseph Maloney at the time, said, you know what, you're better than that. You need to go back to school. And that's what I did. I went back to nursing school. And actually the first year they paid my tuition because they had that much faith in me. And that's why I am a nurse today.
Hi, I'm here with Professor Linda Roja, and I will ask her a few questions. And my first question is, who was the leading activist in the birth control movement?
That would have to be Margaret Sanger.
Yes, correct. My second question.
Long time ago.
Yeah, actually it was quite a long time ago. When was the first birth control clinic opened in the U.S.?
In the U.S.? Well, I know she's from the late 1800s, so I'm going to have to say probably the teens, 19-something, the teens.
Yeah, you're close. Actually,
Okay.
It was in 1916, and it was in Brooklyn, New York.
Oh, okay.
Yeah.
Yeah, I think she was from that area.
Yeah, she is.
Mhm.
She is from that area,
Mhm.
from up north. And do you know when birth control actually became legal?
It took a long time.
It did.
It was actually in my lifetime.
I think so. I'm not quite sure, but I think so.
I'm not that ancient. I think maybe in the 60s, 70s, something
Absolutely correct. It was
Okay.
in 1966, 50
Mhm.
years later, but it was only legal to married couples.
like that.
Yeah, I thought that was pretty interesting.
Well, actually, I wanted to pick a profession that I could really help people and, quality care and so forth. And I actually have a few favorites. One would be Jean Watson, who wrote the theory of caring, human caring, which I like very much. And I like Rosemary Parse's question, what's most important to you today, as you already know, in my clinicals.
She injected us
Uh-huh.
in us very well.
Yeah. And then if I could also name Molly Clay here at Montgomery College, she was always after me to teach, and when are you going to get your master's? So she was like always right there encouraging me to keep moving forward and come and be full-time. So those, I think, would be my favorite three.
Awesome.
Leaders. I call them all leaders.
I'm here with Professor Mbulu, and I have a few questions. Do you know who Mary Eliza Mahoney is?
Yes, I do. She was actually the first African American to graduate from nursing school.
That's right. Do you know how she influenced nursing today?
Yeah, she opened the door for other races to join the nursing profession.
Is there a nursing leader that has influenced you?
For me, mainly looking at the theory for Virginia Henderson, the theory is a great influence for me. And I just like what she stood for, what she stands for, and what the theory stands for.
Why did you become a nurse?
Oh, wow. Okay. Why did I become a nurse? I became a nurse for two reasons. When my dad was ill and he was about to die, back when I was in my country, I loved the way the nurses took care of him. And I said to myself, oh, when I grow up, I'm going to be a nurse. Because they were so loving and caring towards him. But when I got here to the United States, I found that it would be difficult to get into nursing and decided to do mass media, reading and writing news. But when I got pregnant with my son, I met a doctor at Holy Cross that took care of me because I had incompetent, problem pregnancy, and took care of me, had a baby shower for me at Holy Cross in the hospital. So at the time I had the baby and I got out, I was about to leave. She gave me a little suitcase and said it was for the baby. So I asked her how I could pay back. What could I do to ever thank her for what she did? And she said to me, "It's either I become a nurse or I become a doctor, so I can do for someone else." And that's I have tried to do that in many ways.
I'm in the nursing lab right now, and I'm gonna ask Linda Friday 2 questions about Lois Capps, and she is currently a Congresswoman too, and a nurse leader. So question 1, Lois Capps has authored legislation to improve the prevention, diagnosis, and treatment of, select all that apply. A, heart disease, B, stroke, C, cancer, and D, arthritis.
I'm going to make a wild guess and say stroke. I don't know.
Yep. One of them is stroke, and there's another one.
Okay, another one?
A was heart disease, B was stroke, C, cancer, and D, arthritis.
Stroke, so I'm going to say heart disease.
Wow, okay.
Actually, it was a combination of factors that led to my choosing nursing as an ultimate profession. One of them, I would probably say one of the most important people, was actually a nurse that that took care of me when I was in the hospital, and I don't even know her name now. But I was in isolation, and she spent a lot of extra time with me. She came in and just cared for me, about me as a person, asked me questions about my family and stuff that no one else did. And so she inspired me. Wow. And yeah, she was probably the most important, but then, like I said, I don't know her name. I was 28 years old. I was the mother of 2 young children. I didn't know if I would ever live to see them grow up, and she recognized all those issues.
Wow. That's why we should all be good nurses.
Yes.
For that inspiration.
And there's so many different things you can do with it. You can, do bedside. You can work at a computer. You can just do so many different things.
Yeah.
It's very rewarding.
So, can you tell me, Professor Sprague, what were Florence Nightingale's major contributions to the field of nursing?
I think research, and that she started the evidence-based practice. She identified that hand washing and cleanliness were so important. So that's what I feel, like evidence-based research back then.
Evidence-based research practice, that's true, in the documentation and the cleanliness.
Documentation, her research, yeah. She would document all the research findings, so it was very interesting that she did that. It was cool.
Excellent. And can you tell me what she contributed to nursing education?
Nursing education. Well, I think she's the one that started, her own school of nursing.
Mm-hmm.
And I think the curriculum that she followed, she knew what the needs were for that level of nurse coming out. And I think that identified what our needs were, very basic nursing. I don't think I have her book here. No, I don't. Her little, Nightingale's nursing notes on nursing, I think helped us, form our basic curriculums in all the different schools of nursing. Didn't really make me want to go into nursing, but there is a nursing leader, a nurse theorist that I actually really like, and that I believe that her theory is true to this day. Martha Rogers, I don't know if you are familiar with Martha Rogers. Her theory was the theory of openness, and that it had a slinky, it involved a slinky, and actually I do have it up there. The purple one is my Martha Rogers book. This is why I keep this here, because she, her theory is theory of openness, and that if you're the patient, I'm the nurse, and I'm going to give you this end. It's like a give and take kind of a thing. So if you do something to the slinky, like anything you do, it comes across and I have to react to it and do back. So it's kind of like how a slinky works back and forth. Slinky lady, Martha Rogers.
We're talking with one of the lab coordinators of Montgomery College. I'm going to ask you a few questions about the by name Dorothy Dix. What do you know about Dorothy Dix?
Well, I know that Dorothy Dix was one of the pioneers for nursing.
It's like I'm heading in that direction.
19th century.
But
she was a social reformer. She's the one that advocated for mentally ill prison patients to better their conditions there, to make the living situations a lot better for them. And also she was part of the, in the Union, she was, they called her in to help with the soldiers in the Army during the Union, to help with the medical supplies, to help give care to the soldiers. My family inspired me. I have a lot of nurses in my family. My mother's a nurse, my dad is a nurse, my aunts are nurses. So I've always wanted to be in the medical field, but looking at them work and knowing that they come home and they're, made a difference in someone's life just kind of pushed me in that direction, because I look at that and that's something that really matters to me, is to make somebody feel better at the end of the day. So that's one thing that pushed me, is them, seeing them, happy about that.
We're here with Professor Stevens, and I'm here to ask you some questions about a nursing leader. So, what do you know about Edith Chapel?
She really represents something that was very typical about nursing during the era in which she practiced as a nurse, in the late 1800s or early 1900s. That women of some privilege, such as Florence Nightingale, and many women during the Civil War in this country, chose to become nurses as a way of helping out, as almost like a religious calling. And her particular experience of helping prisoners of war, trying to save them from being put to death, is something that is even more magnificent in terms of the sacrifice that she was willing to make. So I think that nurses now, in contemporary life, are doing that in many ways, maybe not in as dramatic a fashion as she did, but certainly during the earthquake in Haiti, many nurses who are employed by the Red Cross, the International Red Cross, as well as various volunteer healthcare organizations, went to Haiti, and they risked their lives because there were still aftershocks, and they could have very easily become injured or even died in their efforts to help others. So this is something that even if you don't find yourself becoming a nurse as a sort of a religious calling, you find yourself becoming a nurse because you know what you want to do is help people in some way. And even if it means putting yourself in harm's way, you'll do that. The question of what was my first real exposure to nursing, and it really was from my mother, who was not trained as a nurse, but she developed very good nursing skills, taking care of my older sister, who during her adolescence had to be more or less confined to bed rest while she was being treated for scoliosis. She had spinal fusion surgery. She had to wear a brace from her neck down to her hips, and she was really more or less confined to bed for almost a year. And I watched my mother take care of her, do all the bedside nursing tasks that we all learn in the beginning of our training, and I saw how much she made a difference in my sister's life at that time. My sister was only about 15 years old. And so it made quite an impression on me, and it made me decide that what I wanted to do was choose a career where I would be helping people. And so nursing was the natural choice for me.
Hi, I'm here with Professor Roja, my favorite professor. No, I can't say that.